Okay, good afternoon, everybody. My name is Reza. I work at the Guidance and Recruitment Office here at UniSR. I see that we have still a few people, so I will just wait a few seconds to see all the people joining us. In the meantime, I'm pleased to welcome you at our info session dedicated to our international MD program taught here at UniSR. I have here not only my colleagues from the Marketing and Communication Office. I am pleased to have also my colleagues, Anwar from the MD Secretariat, my colleague Truly from the Admission and Credential Evaluation Office, and of course, Professor Chiara Di Resta. We're very happy to have also a testimonial from our student, Fabio Crippa, who is enrolled in our MD program, and he's at our 4th year, right? Perfect. I think we're almost there. Okay. Our session is going to be structured in this way. I will just steal a few moments of your time with a brief description of our university. I will then leave the floor to Professor Chiara Di Resta, have the testimonial from Fabio. We will have then a last section dedicated to the Q&A with a few questions that we collected from you and our prospective students, the most asked questions, and my colleagues Virginia and Anwar, we will be here to respond to your queries, and also, of course, the question you will have in our chat. So I will start now. Who we are. So for the people who are not really familiar with UniSR or Vita-Salute San Raffaele University, we are quite a young university. We've been funded in 1996. And since its foundation, the main question and the main mission of our university has been to reply to the question "Homo," that comes from Latin and means what is a man. So what is a man? It's all the features of a man. So mind, body, and how to reply to this question through the research and the study of psychology, philosophy, and of course, medicine. And since its foundation, it was very important for us to have a strong integration of these features. As I was telling you, we are quite a young university, founded in 1996, but through the years, we have reached a few milestones, especially in education, research, and teaching. I was talking about the schools, so I was talking about the 3 faculties, but actually we have many disciplines. It's not only medicine and surgery or psychology and philosophy, but also biotechnology, dentistry, and health professions. As of now, we have 7,000 students enrolled, not only in our bachelor's or master courses, but also for our specialty schools and postgraduate offer. And very important, this is probably one of our main features and strongest synergy collaboration, and it is with a very renowned hospital here in Italy, which is the San Raffaele Hospital. Both UniSR and San Raffaele Hospital are part of the Gruppo San Donato healthcare of the biggest one in Italy. As I was telling you, although despite being young, we have ranked quite well in the last years. Last to mention would be the what we reach through the ranking of Times Higher Education and being at the first spot for research. I will leave now the floor to Prof. Chiara Di Resta. She's going to guide you through the program and all its main features and why joining us here at UniSR for the MD program. Thank you.
Thank you. Thank you, everyone. Good afternoon, and thank you for attending this info session dedicated to our MD program. It's a pleasure for me today to describe you which are the key features of the international MD program at our university. A few words to introduce myself. I'm assistant professor of clinical pathology in the Faculty of Medicine. I'm the coordinator of the second year course of clinical laboratory medicine, and I support our students during the first steps of their academic path as tutor and coordinator of the first year of the MD program. So one of the first questions that maybe you have is why choose an international MD program? So one of the most valuable aspects of this program is the opportunity to study in an international environment. You know that today medicine is a global profession, and by joining an international MD program, you will leave a multicultural classroom with students from all over the world. And this experience allows to prepare yourself for a medical career with a wider brief and prepare yourself to work in diverse clinical settings all over the world. Now, I would like to give you an overview of the structure of our MDP curriculum at a glance, and I would like to highlight which are the key features that characterize our MD program, which are the educational model and which is the study plan that is inspired by international models according to the vision of the Dean, Professor Salonia. So the International MD program at Vita-Salute San Raffaele University is a 6-year single cycle degree program who is characterized by an innovative top-level interdisciplinary teaching methods. Contents are organized to ensure an progressive specialization with an increasing complexity corresponding to the skills and competencies gradually acquired. During the first semester, you can see on this slide that students acquired a solid fundamental knowledge and skills in the field of biomedical education. You have to imagine that it is our backbone that represents the foundation upon which to build further levels of knowledge and specialization. In our course, starting from the first year, we have also courses dedicated to humanities. You can see here. That means considering the humanistic sides of medicine. That means the importance, for example, of communication in the complex doctor-patient relationship and the relationship between medicine, ethics, and society. Because our philosophy in our program is the idea that it is fundamental not only to work a medical doctor, but to be a medical doctor. As the dean always saying to our students, you have to imagine that you are a medical doctor starting from the day number 1 of your MD program. Then the curriculum is centered on preclinical and diagnostics topics through a multidisciplinary approach with the attendance of a simulator lab, which I briefly mention later, or the discussion of clinical cases to apply the main topic discussed during the frontal lessons to the clinical practical case. Then the curriculum presents a progressive clinical specialization with increasing complexity of skills and competencies. And you can see here we have 2 courses dedicated specifically to the management of acute patients and chronic patients. So to explore the chronic patient treatments with the medical approach, with the chronic care and surgical approach, and acute patients encompassing, for example, internal medicine, emergency surgery, or intensive care. One of the main features of this course is that students can tailor medical education thanks to the structure of 4 different tracks, selecting courses that align with their interesting passion, customize their education, and focusing on area of interest. And later I will explain you more in detail which are these tracks. Our educational standards is focused on a hands-on learning experience, and we expose our students to a real-world problem. Indeed, you can see here that while studying, students improve their practical skills starting from the first year. In the first year, we have the nursing course, in which our MD students works together with our nurse students in the hospitals departments, or then in the shadowing activities, MD students works together with the residents, and then there are the clinical rotation, track rotation, licensing rotation that expose our students again to the real world in the hospital. Moreover, at the end, in addition, the program offers a block of the last semester that is free of classes, allowing students to devote themselves to their research thesis or the research project. You can see in the slide in the next point that that period is named additional project. That is a unique opportunity that can be performed and conducted at UniSR or in other Italian or foreign institution. So in the next slide, I would like to point out which are the main features that makes the international MD program at UniSR unique. That is the ability to tailor your educational experience through 4 specialized tracks. These tracks allow students to, again, align their medical education with their personal interest, career aspiration. And so let's take a close look at each track. So at first we have the general track. In the general track, it is a track that is open to all students and offers a variety of elective courses in internal medicine, surgery, diagnostics, and research. And in that track, it ensures a broad medical education. Then we have the medicine surgery track, offers a hands-on approach, allowing to develop strong clinical skills and confidence in patients' care settings. Then the global health track. This track is perfect for students passionate about public medicine or social health management. It delves into key topics such as healthcare management, healthcare economics, or access medicine to low-income countries. Then there is the translational research track that is designed for students interested in bridging the gap between the laboratory research and clinical application, with course dedicated to basic translational and clinical research. As I said, while the general track is open to all students, the other 3 tracks, so global health, medicine and surgery, and translational track, are selective and reserved for high-achieving students. Then a key element of medical education, I told you before, is the practical, the hands-on experience. And we provide students with state-of-art training facility to improve and to refine their clinical skill. And we have two resources available in our campus that are the simulation lab and the cadaver lab. In the cadaver lab, students have the unique opportunity to explore human anatomy in a real and detailed manner. Or in the simulation lab, you can see here, the lab is equipped by high and realistic mannequins that mimic real life patient scenario. And here, for example, in that picture, students are practicing essential clinical procedure, such as, for example, the peripheral blood draw, or administer injection, or other handle emergency situation using a high fidelity simulator. Moreover, behind the classroom and the laboratory training, students of the international MD program have access to outstanding clinical rotation opportunity in San Raffaele Hospital or in other institutions abroad. In our MD program, we provide a structured tutoring and mentoring program to guide students through their academic path, academic journey. It is another important feature of our program. Indeed, each year, each academic year, students are assigned to a dedicated tutor that is a faculty member who serves as a key reference point for academic concerns, course guidance, or overall support. And in addition to the faculty membership, the program also offers a peer-to-peer tutoring. That is an activity where students can receive supports from classmates in higher years. And this activity allows students who need extra help preparing for exam to seek guidance for their more experienced peers, sharing, for example, the study strategy or course material, etc. Another key example of the stimulating and the research-driven environment in our university is that project. And I'm so proud of this project of our students. It is the Uni4Me project. This project is a research project that was born from the idea of the third-year students who proposed a research project to the faculty members, in which students themselves took an active volunteer role with the support of the university and after the approval of the ethics committee. Students lead the project, analyze the results, and now the research findings are under review by a prestigious journal in the field of the laboratory medicine. This scientific initiative also allowed students to present their findings at conferences, congresses, or scientific events, such as the San Raffaele Scientific Retreat. That is an annual event where the university scientific community shared their cutting-edge scientific results. And here, for example, students have the chance to engage with the researcher, with other principal investigator, further integrating themselves into the academic and research world. Other scientific and cultural exchange activities in our campus are, for example, the Journal Club, or, for example, other events such as the Mission Brain, Spritzale Meningi. So a lot of events that are organized by the students themselves that enrich the campus life. But for sure, the campus is not only characterized by science, but MD schools means also building lifelong friendship and joining a dynamic campus life with events, sports, gala, party, etc. And that events allow to celebrate and build a sense of community that lasts a lifetime, connecting with past alumni, sharing experience and supporting each other. And so to conclude, I have chosen that picture. I like it a lot. It is a symbolic picture. As a tradition, the 6th years students conclude their final day of classes with a group photo on the San Raffaele Dome terrace at the end of their academic journey, at the beginning of their professional career. So I hope that I have given you an idea of the key feature of the MD curriculum and the dynamic and active atmosphere that define the International MD program at our university. And thank you again.
Thank you so much, Professor Diresta. It was great to have your presentation and the enthusiasm you showed to introduce us to the program. We will have now our student, Fabio Crippa, who's gonna share with us his testimonial and his experience as an MD student. Thank you, Fabio.
Thank you very much. Good afternoon, everyone. So, as I said, I'm Fabio. I'm a 4th-year student here enrolled in the International MD program. And in these few minutes, I wanted to share with you some of my personal experience with what Professor Diresta has told us now. So all the possibilities that the International MD program offers. So, for example, the first experience I wanted to share with you concerns the human anatomy practicals. I participated in this activity in the July of my 2nd year, and it took place in Verona. So I also had the opportunity to visit the city, which is always quite nice. And we were working with real human bodies, as you can imagine. These are practicals done on cadavers. And the fact that we could actually work on real humans made what we have studied for months on the books and try to imagine or read or look in the picture was now in front of us. And these donors had made the decision after passing away to offer their bodies so that we can learn and advance our medical knowledge. So this experience was not only increasing our knowledge as professionals, as students in the medical field, but I think it was also a human experience because we get in touch with people, even if that we understood what practicing medicine actually means, because we are dealing with life and death every day. And another opportunity that has been available to me in the past years is the opportunity to participate in lectures given by Nobel Prize laureates. We hosted in San Raffaele, for example, 2 lectures given by Craig Mello, who won the Nobel Prize for his studies on RNA interference, and Drew Weissman, who talked about his works on mRNA and vaccine production. So as you may know, mRNA technology has been used for the development of COVID vaccines. And hearing Drew Weissman talk about his works was actually a privilege. Since I was a child, I wanted to be involved in the medical research, and having the opportunity to actually see and listen to people who changed the landscape of medicine is really important to me. And this also made me continue thinking that I wanted to be in research in order to increase the knowledge we have in medicine, to possibly change the way in which we practice medicine and in which we treat patients. But university life is not just about studying books, lectures, and responsibilities, because we also have responsibilities, but it's also about stepping outside the academic mindset and experiencing new things. And as we said, it's about also meeting new people and creating memories and finding a balance in life. So during my 3rd year, I participated in one of the activities organized by students group, which is called Io Ci Suono. For the past 8 years, I've been playing the electric bass, and I also played in some small concerts. And when I heard that there was a group of students playing musical instruments that gathered together, I knew I wanted to be part of that. So this is a group, student-run group that organizes events in which we can play, organizing bands, and play for us fellow students. So as I said, I played in other small concerts, but this gave me the opportunity to feel involved in a community. I was playing for my fellow students, and it was an evening not only of entertainment, but also a chance to unwind and remind ourselves that university is not just about academic achievements, but it's also creating connection and enjoying the present moment. And the last thing I want you to talk about is a story that comes from the world, and it's a story that is pretty dear to me. It's a story of a patient that I saw in the cardiothoracic intensive care unit, which, as you may imagine, is not an easy ward to be into. It's a place which is sometimes filled with grief and sorrow. She is a 23-year-old girl, so basically my same age. I'm turning 23 tomorrow, so she's basically my same age. And she had a very severe pneumonia that developed due to a genetic condition that she had and brought her to the ICU. She required intubation and extracorporeal circulation, so she relied on machines to stay alive. I saw her when she was still intubated and hooked to the ECMO, so the extracorporeal circulation. I stayed there 3 weeks, and during these 3 weeks, I witnessed every step she made. First, she started breathing on her own, but she couldn't speak. She then started to speak again. And then she started walking around the ward, even though she was still attached to the extracorporeal circulation machine. We then removed even this machine, and she was completely free from machines. And I saw every little step she took. And when I saw her walking around, completely different from the first time I saw her, I knew why we are here, studying medicine, and then possibly practicing as doctors. We and I hope to make this kind of impact on the life of people that live around us. And with this, I thank you, and I thank you for the invitation.
Thank you so much, Fabio. It's really amazing to see how this program is not only part of your career path and like a tool to achieve your dreams, but also something that reminds you like how important it is to be here and inspire other people. And so thank you for sharing. We will now jump to the last section of our session. It's going to be our Q&A session. We already have collected a few of your questions in the chat, but we will start first from the few questions we received in the last day. This first slide, I think, is more addressed to Virginia from our admission and credential office. So I will leave the floor to her. Thank you.
Hi, everyone. Thank you. So I will just go through the questions we received in the last few days. So let's start from the requirements. So what are the access requirements for the MD program? So first of all, you have to have a valid diploma, and we will guide you in the evaluation of your diploma while applying to the international MD program. And then the only means of evaluation anyhow is the selection test for the next academic year 2025-2026. Applications are already closed. The first session has already taken place, and in about 15 days we will have the second session. And a third requirement is the English language. So at the moment of your enrollment, we will request you C1 level of English, which you can testify by providing an English language certification, or if you have already studied in English for at least 2 years, you can provide your English awarded diploma. Next questions: how to prepare for the admission test? So the test will cover the high school level knowledge about scientific subjects mainly, so like logic, mathematics, biology, test comprehension. So for that, you can, of course, rely on your school books. But if you want to focus more, we always offer some preparation courses. And also a tool that I truly recommend is our online simulator. You can start buying a first pack of 3 tests for 20 euros. And then if you want to take more, it's 5 euros more per test. And it allows you to train with questions that were used in past selection tests. So also I can suggest that you can have a look at other preparatory book that are generally used for university entrance exams. They are pretty general, but they can still be a help for your preparation. Next question. What is the minimum score to pass the test? We do not request a minimum score, and generally we do not really give information about that, because from year to year, information varies a lot. You can imagine that it depends on how many applicants we have and how do test for that specific session. So this kind of data really tends to vary a lot from test to test. However, you can consider a good score 30 points out of 60. Is it possible to submit for MD program for academic year 2025-2026? So as I was saying before, applications are now closed. We already took the first session and we're having a second session in April. However, please always have a look at our website, where we always publish on time every information or news about the selection process, calls for admission, and so on. For those who already took the test, the rankings will be published in the next couple of weeks. So as you may know, there are 2 ranking lists, one for EU candidates and one for non-EU candidates. So the ranking list for non-EU candidates will be published within April 10. Meanwhile, the ranking list for EU candidates will be published within May the 2nd. After that, EU candidates will be required to make an advance payment in order to confirm their place. Meanwhile, EU candidates will be required to confirm their place without advance payment later on in June. And for that, you will find all the information published on our website. Finally, last question. Can you give details regarding reserve list? So the actual enrollment period will start on July 1st until July 21st. This means that all the admitted candidates in the ranking list will be able to enroll within those 3 weeks. After that, after July 21st, we will start with the scrolling of the ranking list on the basis of the available places. And the scrolling of the ranking list will take place every 3 working days. So it means that you always will have to have a look at our website to stay updated with the timing and to monitor when your turn to enroll will come. So for the questions collected, I think this is all, and I guess that I will pass the word to my colleague Anwar for other questions on the academic part of the program.
Thank you, Virginia. Okay, good afternoon. My name is Anwar. I'm from the MD Secretariat's office. And I'll read the first question. So, how are lessons scheduled and how many lessons would I have per day? What is the minimum requirement, the minimum attendance rate? Okay, so basically a typical day at campus, you'd have 4 lessons scheduled with 2-hour slots, so 2 in the morning and 2 in the afternoon, where the first 3 lessons are reserved for integrated courses, and the last lesson from 4:30 to 18:30 is usually reserved for elective courses. The second part of the question, what is the minimum attendance rate? For integrated courses, it's 67% and elective courses, 80%. That said, I think Fabio can confirm, if you do decide to join the program, you need to plan to be 100% of the time. Okay, moving on to the second question, how many exam sessions are scheduled in the academic calendar? So usually we schedule 4 sessions. So it's winter, spring, summer, and fall. So the winter session being in February, and the duration is usually a month. The April session is usually a makeup session. And then you have the June and July session, which is the longer session, and it's usually about from the last week of June to the end of July. And then the fall session is in September, and the duration is usually a month. The third question, what support system do you have if I have difficulty keeping up with my studies? I think Professor Di Resta covered it in the presentation. I think it was slide 16. We do have a tutoring system where you have at your disposal professors for your year who will give you various advice on how to go about managing your studies. And then also we have a peer-to-peer system where older students help new students, incoming students with their studies. The fourth question, do you provide an Italian course for foreign students? Yes, we do. It will be scheduled on your calendar, and an exam session will be held. I think you need to have the Italian certificate by the end of your second year to allow you to do your practical activities and enter wards, etc. Do you provide scholarships? I think it's more of an admission question, if I'm not mistaken, Virginia.
About scholarship, I guess you can find all the information on our FAQs and on the website. Sorry, I just take the chance to answer to Ian, who asked if I could repeat what is a good mark for the entrance test. So a good score would be 30 out of 60.
Virginia, I think there is
the last question. Can you give information about dorm facilities and residentials? Yes, we can. If you write to us at mdprogram@unisr.it, we'll send you all information with regards to on-campus living and in-city living.
Yes, just to provide a couple of information on the dorm facilities. We have 2 dorms that are quite close to the campus. One is like really inside the vicinities. It's Casina Melghera. And then we have Cascina Castinella, which is 1 kilometer away from our campus. And usually call for applications are open in March. So probably, no, right now I can confirm we have a call for application open. And for the students who are already enrolled, probably is not the case for most of the participants in this session, the deadline would be by the end of April to apply. And for the all first timers, it would be around the end of July to apply. The cost is around 7,000 per year for one dorm, and the other is a little bit more expensive, is 10,000, because it's more modern in facilities and the features of the dorms. But all of the rooms are single rooms with bathrooms. As Anwar was saying, you can find all information on our website, and also send an email to the residenza universitaria at unisr.it. There are a few questions that probably are more related to didactics. One was about translational research. Laura Antonioli asked, could you please tell us more about translational research track? Will there be specific classes made of 20 students each for one of the 3 single tracks? Probably Prof. Chiara Di Resta or Anwar can respond to this question.
Anwar, if you want, I can try to answer. I confirm that we have only 20 students for each track. The translational research track is characterized by elective course that are mainly focused on, for example, bioinformatics and system biology, or omic sciences, or flow cytometry. The goal is foster the potential for future research careers. So there are more researcher application or example of cutting edge findings, in order to again introduce the students in a more research path that could be basic translational or clinical research.
Thank you, Professor. We have a couple of questions. I think these are more addressed to Virginia. One question from Belin Picasso Matteo Felice says, the IB English can count as an English certificate, one. And then we have another question that says, my 3-year degree was studied and written in English. Would I still need to provide an English test?
Yes, both diplomas are valid. So in this case, you don't have to provide any other English certification.
Okay, I think we have a few more questions. I don't know if these are information that we can disclose, but still related to admission. How many people registered for the IMD test this year, especially for EU? And I think there was another question very similar.
I don't have this data at hand. Anyways, we generally do not tend to give this type of information. However, when you will see the ranking list, then you will have an idea of the candidates.
There is a question. This is, I think, for us, for the recruitment office. Are there any open days coming soon? Yes, I confirm there is an open day coming soon. It's scheduled on Saturday, 10th of May. I will send the link here on all information about our open day and how to register for it. It is an on-site event. So for whoever is here in Italy, close to Milan, it will be a great chance to have the presentation also by other faculty members and also other testimonials. Another question coming here. Do we need an Italian language certificate for admission in the university? For Virginia.
No, for the enrollment, only the English language certificate will be necessary. However, how my colleagues anticipated, then you will also have to get a knowledge of the Italian language at a level B1. Of course, this will necessary to access the training in the hospital and get in contact with the patients.
Thank you. There is another question here. I don't know if we actually have this information, but I will read anyways the question. Have there been any changes to an admission test for 2026, 2027? When are the next prospective dates?
Wow. No, at the moment we do not have information. However, you can expect to have specific information for the 2026-2027 selection process during the autumn, so in September, October, more or less.
Thank you. And a couple more questions on the didactic side. I wanted to ask how GPAs is calculated in UniSR from Nataralka. Are the exams oral or written? Anwar?
Okay, so with regards to the calculation of the GPA, I'm going to have to get back to you on that one. Honestly, I don't have the information with me. With regards to exams, the exams can differ from only oral to written and oral, or written only.
If I've spent 6 months abroad in a school in England, does it count as certification? Thank you. From Federico Castello.
Yeah, no, Federico, I'm sorry. Only if you attended at least the last 2 years of school entirely in English. 6 months period of exchange doesn't count for that. You will have to get a certification.
Thank you. We are almost at the end of this session, but I can read a couple more questions. Is there going to be a single class of 150 people or more than one? Sophia asked. So Anwar, I think it's more like on the number of people in the.
Okay, so I think the maximum amount is 150 students per class. So it will be one class of 100, maximum 150. Yeah.
Okay. Sara Sironi asked, could you repeat the number of places for EU students?
Yes, I just replied to her in the chat, but for everyone, places for EU students are 86 and 64 for non-EU students.
Please feel free to reach out to us if you have any more questions or you have specific questions that haven't been covered during our session. You can for sure send an email to our office, which is study@unisr.it. I will send it here as well. A last question. Do you have info regards transfer? Yes. So transfer usually take place during a very specific time of the year, and calls are open in June, July of every year. So please have a look at our website during those time. And you can also send an email to our email address, study@unisr.it, so that then we can refer you to our office of that deals with transfers. Okay, I will then just read last question. We are at the end of this session. I concur with the above question. Does age play a factor to the admission requirements? Virginia?
Yeah, no, as I was writing in chat, so you can also have my reply as a reference. No, age is not a factor. The only means of evaluation, the only means of selection is the admission test. And beyond that, as I was saying, we will assess your study path only to verify that your diploma allows you entrance to university courses in Italy, and then the English language certification is an enrollment requirement. But for the selection process, the only means of evaluation is the selection test.
Thank you so much, Virginia. I think we have reached the end of this session. We thank you so much for the participation. I personally thank you, my colleagues from our Guidance and Recruitment Office and our Marketing and Communication Office, but most especially our student, Fabio, colleagues, Virginia and Anwar, and of course, Professor Chiara Di Resta. If you have more questions, please do not hesitate to get in touch with us. I sent you our email address in the chat box, is study@unisr.it. And of course, as I was telling you, there is a chance to join us during the open day, which is an on-site event. And also a few other on-site events. We have open classes for all prospective students who want to have a glimpse of what what studying MD here at UniSR is. So we have, I think, one lesson in mid-April and another one in May, and you can apply to come. I think it's open already, so please have a look on our website. Thank you so much, and have a nice evening. Goodbye.
Thank you. Goodbye.